This presentation offers an overview of social prescribing for primary care teams. It's based on a detailed evidence-based report which includes examples from practice. There's increasing awareness of the social and economic significance of health and well-being, and therefore the importance of a society-wide responsibility. Social prescribing is emerging as an area of practice in the context of a number of policy and practice developments in primary care and mental health. Social prescribing in primary care is a relatively recent concept, describing the use of non-medical support to address the needs of people whose mental health is affected by depression or anxiety. Research suggests a range of positive outcomes, including emotional, cognitive and social benefits. It has also been identified as a way of reducing social exclusion. Common activities included in social prescribing, among reports reviewed, include self-help, exercise, arts and creativity, green activity, community learning and supports, including volunteering, debt advice, etc. There is good review-level evidence for the efficacy and effectiveness of a number of interventions for addressing depression and anxiety at primary care level. Relevant interventions include guided self-help, cognitive behavioural therapy and computerised cognitive behavioural therapy, and structured group physical activity programmes. Other activities such as arts and prescription, ecotherapy, community learning and supports have all been proven to have positive effect on general well-being and mental health. Many of these studies have been carried out as pilot projects and would therefore require further large-scale, more sustainable studies to identify the true extent of their impact. Social prescribing practice takes a range of forms, but a number of core elements can be identified from the models reviewed. The primary care team is a central component of the social prescribing model, acting as referrers and sometimes as coordinators of the social prescribing service. Some coordination of social prescribing is contracted out to voluntary or community services. Activities to which people are referred are located within the community, generally provided by the voluntary and community sector. Supporting the relationship between primary care teams and the community sector is pivotal to successful working. An information resource, such as a directory or a service who keeps up-to-date information on what supports are available in the community, is another key element. Details on the evidence base, current practice and recommendations for the definition and implementation of social prescribing practice in Ireland are contained in the research report. Some key recommendations are that social prescribing should be considered as integral to the development of primary care team and mental health services. Planning needs to take into account that social prescribing practice can increase demand on voluntary sector services. A collaborative approach at local and national level is essential. Finally, a national research framework for social prescribing projects would ensure best use of resources locally by building an evidence base and generating effective evaluations. Measurement of effectiveness should occur at individual, population and service level.